Well, hello everyone, Dr. Larson here again, and I have another special case for you here. This is Hadassah. She was in a car accident several months ago, and she's been having back issues, lower back, headache pains, lots of different symptoms, and she's been getting better. She's been doing massage lately, which has been improving her as well. But one thing that we kind of continue to notice, because when she was driving and someone hit her from behind, and she hit her face on what? The steering wheel. So she hit the left side of her face on the steering wheel, broke her nose in 3 spots, and then also broke the nasal bone here away from this bone here. It's called the maxilla. So right here, she broke that away. And her nose actually kind of curves to the left too. So last October, it is January 2016 right now. Last October, she went into the plastic surgeon, right, to see if she could get that nose fixed. And it hadn't healed at that point enough. When was the accident again?
July.
The accident was July, so this has been quite a long time going on. And we're basically waiting for her nose to get fixed, and I'll show you why. Because it's causing a lot of ongoing issues with her low back, mid back, and headaches. Most of the low back and mid back neck pain is gone now, but she's still having the headaches. So July was a car accident. She went in October to go to the plastic surgeon to see if she could get the nose job done and fix that nose. But what they said was it hadn't healed enough at that point, right? Mm-hmm. Yeah, so now she's waiting. It's January, about mid-January right now of 2016, and you have an appointment next month sometime, right? So sometime in February she has an appointment to actually go back and look at that and do some surgery on that. And then from that, after she heals from that, we'll have to do more work on top of that to make sure everything's fixed, and I'll show you why. So one thing that we do is called proprioceptive muscle testing in the office, and it's evaluating the person's nervous system to see how things are working. And one thing that we notice with Hadassah is that when we check any muscle in the body, but her lower legs, I'm going to do it here, push out to the side here, she's very, very solid on this right side. So we can push up and out here, very solid there. That's a tensor fascia lata muscle, and then the gluteus medius. Here's a lower back muscle on the right, so pull your legs that way. And she can really use that muscle very, very well. Now on the left side, pull your legs that way, hard as you can. You pulling hard? Mm-hmm. So I don't have to do anything because this side isn't working. It's neurologically not working. There's a disconnect somewhere there. So we come here, the gluteus medius muscle here, and it's a muscle in the hip. Push out to the side here. And there's really nothing. There's no contraction there whatsoever. Push up and out here. And again, there's not much happening on the whole left side of her body. Now remember when I said at the beginning, she hit the steering wheel on the left side of her face. So now we're going to have her just change the input to her brain. So we're going to have her just push on the nose in different spots to see if it makes a change down here. So the first one we're going to have her do is right in the nasal bone up in here. So she broke this nasal bone in 3 different spots. So right where that nasal bone is, right in here, is where we're contacting. And she's just putting pressure on there. And anytime you put pressure on the skin or a joint anywhere, you're activating nerve receptors, which fire up into different parts of the brain as well. And then that changes the output coming down. So we're going to check here and see what happens. Push out to the side right here. And it gets a little better. She starts to get some contraction there. Can you see the muscle there? So up and out here, it gets a little better, but not much. So she broke it in 3 spots. We're going to come down a little bit lower here on the nasal bone, kind of like right on the edge of it. Push out here, and that doesn't do anything. Now we're going to come right where the nasal bone and this maxilla bone, so this cheekbone and the nasal bone come together, which is where she separated it from. It actually broke away from there. So she's just going to put pressure right there. Push out to the side here. Push up and out there. Hold your feet towards the window. And you can see on all those different muscle tests, she gets you can put that down, she gets very, very strong there because there's a problem with the maxilla bone and the nasal bone connection point there. So at this point, we can't do much more for her until she gets that surgery done, and then we'll have to kind of clean up the mess from that as well, because it's kind of hard to do it perfectly. But at this point, we're basically just waiting for her to get the surgery to see what happens from that, if we can start to clean some of this up. Because as you can imagine, if you don't have any lower back stability, neck muscle, hip muscles on one side of your body, eventually you're going to have pain. It's inevitable that you're going to have pain on one side of your body or the whole spine or somewhere. So that is our story for today, and we'll see you soon.